Hi my friends, my name is Sam and I'm super excited because this is the first video on my YouTube channel and I hope I can upload more videos if I get your feedback. Well, in this video I want to talk about everything you need to know about the medication. Stay tuned. First of all, let's see how its pronunciation is. It's levothyroxine. Levothyroxine. Keep in mind that it also has a few other less common pronunciations like levothyroxine. Warning, warning, warning. Never use levothyroxine as a fat burner. As a hormonal medication that is prescribed under specific situations, that weight loss is not among them. Using it as a fat burner may result in serious or even life-threatening problems. Levothyroxine is a synthetic form of T4, an endogenous hormone secreted by the thyroid gland. T4 will be converted to T3, its activated metabolite. T3 and T4 then bind to thyroid receptor in the cell nucleus and exert metabolic effects through control of DNA transcription and protein synthesis involved in normal metabolism, growth, and development. Levothyroxine has different dosage forms: capsule, tablet, solution for IV injection, and oral solution. The main indication of levothyroxine is hypothyroidism. It also can be used in myxedema coma and TSH suppression. Let's take a look at some conditions and see if they need dose adjustment. Most of texts say that nope, in kidney impairment, no dose adjustment is needed, no matter if it's a mild or severe renal impairment or the patient is adult or a baby. What about hepatic impairment? It also need not dose adjustment. Age ain't a matter too. The only situation in which it's recommended to adjust the dose is in obesity, in the fat patients. In this group, dosing should be calculated based on lean body mass, or LBM, instead of actual body weight. Let's take a look at a summary of administration and tips about how to use levothyroxine dosage forms. Administer levothyroxine consistently in the morning on an empty stomach at least 30 to 60 minutes before food. You can also administer it consistently at night 3 to 4 hours after the last meal. Do not administer within 4 hours of calcium or iron containing products or bile acid sequestrants. In neonates, infants, and small children, if administration on an empty stomach poses a challenge, it may be administered with food, avoiding soy protein and vegetable fiber. Capsules must be swallowed whole. Don't cut, crush, or chew them. Tablets should administer with a full glass of water, may be crushed and suspended in 5 to 10 milliliters of water, but suspensions should be used immediately. For oral solutions, remember to administer it directly into mouth using a calibrated oral syringe. Don't use a household teaspoon or tablespoon. In NG tube cases, it's been suggested to temporarily hold feeding for about 30 to 60 minutes before and after levothyroxine administration. For parenteral use, levothyroxine may be administered by IV injection at a maximum rate of 100 micrograms per minute. And what about common adverse reactions? Significant reactions are some cardiovascular effects, like palpitation, tachycardia, and dyspnea. But these effects usually occur in patients with a history of cardiovascular disease, or in the beginning of treatment, in overtreatment, or in older patients. There are also a lot of other adverse reactions that their frequency is not defined. Adverse reactions from skin rash to vomiting, from fatigue to headache, and from seizure to insomnia. But not all of them may be present in all patients. Based on the reliable texts, levothyroxine is compatible with pregnancy and breastfeeding. So if your doctor recognized that you'll be on levothyroxine during pregnancy and breastfeeding, don't worry, it ain't hurt you. Here I want to talk about drug-drug and food-drug interactions. Consider that they are most important ones, and there might also be other drugs and foods that interact with levothyroxine, Levothyroxine must be discontinued 4 weeks before sodium iodide I-131. So, concurrent use of these two medications must be avoided. Levothyroxine should also be taken at least 4 hours before or after products that contain iron, calcium, magnesium, or bile acid sequestrants. Some foods have a slight interaction with levothyroxine, including soy, grapefruit juice, espresso coffee, walnuts, and dietary fibers. For reducing this interaction, using levothyroxine 30 minutes before breakfast or 3 to 4 hours after the last meal consistently may be useful. When must not levothyroxine be your medication? In uncorrected adrenal insufficiency, hypersensitivity to levothyroxine, glycerol, or any component in the medication, this drug is not your option. But consult individual product labeling as they may vary. Main brands of levothyroxine are Synthroid, Levoxel, Euthyrox, Soloxine, Altroxin, Unithroid, Terrazint, and Thiquidity. Remember that this video is just a summary of different topics in different texts and is just gathered for making information in this field simpler to be understood. For any decision in medical aspects, you have to consult your physician. And finally, if you enjoyed watching this video, please give it a thumbs up, subscribe to my channel, and press the bell button below to be informed every time I upload a new video. Until next time.